This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the fabulous Dr. Martin.
Very fabulous.
Board-certified plastic reconstructive surgeon. Dr. Martin, how you doing?
I'm just waiting for the birthday of our country.
It's very soon.
Very
as we were
soon.
just discussing, it's July 1st when you were hearing this. So
yes.
Yeah, 4th of July is coming. Oh my gosh. So I was at a sport game, a sports event, a sport game. I was at a sport game recently. And I videotaped the national anthem because it's always amazing. And it was just so good. And a friend of mine from the UK actually commented on it. And she heard it somewhere, I think Disneyland, the national anthem when she was visiting the United States, and was so moved. She's I was almost moved to tears. It is such a powerful song. So
it is kind of powerful.
Oh my gosh, I love it. If I'm ever having a bad day, I seriously will listen to the national anthem.
Well, it's funny because you don't really think about national anthems until you watch the Olympics and you hear the other ones, they all suck. So it's just I'm sorry.
Well, or if you go to a lot of lacrosse or hockey games, you hear
Right.
Canada a lot.
Well, Canada's good. That's not true. I actually like that one. And
I fall on ground for thee or something.
Right.
Oh, Canada.
And obviously, I'm a little bit biased after growing up in this country, but definitely we got a good national anthem.
Oh my gosh. Well, it's just chills.
Yeah.
When the rockets red glare, it's yes.
It's got a lot of meaning behind
the
it.
bombs bursting in air. And it's just such a powerful thing. Hey, yeah, proof through the night that our flag was still there.
America.
I love it. So yes, happy birthday, America. I'm a big fan. Oh, something happened there.
Yeah.
So, but getting back to the podcast, we are doing part 2 of our questions from listeners.
Do.
Because we had so many awesome questions, I had to break it up into 2 parts. So if you would like to be included in the next time we do one of these, please leave us a voicemail
What's the number?
a text message.
What's the number, Amy?
The number is right here. 303-630-9038. There is a voicemail on this episode, which I love. The rest of the questions are a combination of YouTube and sometimes from Instagram. So anywhere you leave us a comment, I
like voicemails.
I like the voicemails.
Yeah.
They're just kind of fun and interactive, and you get to hear yourself. So yeah, without further ado, should we do?
Please, yeah.
Let's do this.
I was just waiting.
Oh, so the first question is, this was great. And this actually came directly to email. This was an emailed question to me, and I had to read it because I just thought it was so awesome. This is from Paul. I live in LA, Los Angeles, and enjoyed your talk with Paul Revelia.
Yeah.
Shout out to Paul Revelia.
Yeah.
Paul has
The man.
been my coach in the past. He's Dr. Martin's coach. Awesome. Team Pro Physique.
Amazing.
Super awesome. 142 pounds of weight loss, kept most of it off for over 10 years. I mean, that is remarkable, Paul. Congratulations.
Yeah.
One crappy tummy tuck done after 105 pounds lost. So we went from 330 to 225.
I'm a little disturbed about the crappy tummy tuck, but we're going to go past
Yep, we're going to move past that. Currently, he's 6'1", 186
Man,
pounds.
he's killing it.
51 years old. I mean, seriously, Paul, you are killing it. Stomach and back have lots of loose skin still, which is common, especially if you just had a tummy tuck. Do you have a partnership with any doctors in LA, or can you recommend someone amazing to help me fix the last obstacle in my weight loss life transformation? Any info would be amazing.
Yeah.
So first off, we don't have a partnership with any physicians anywhere, but we do have some friends of the podcast in many places, and I'll answer that question when I email you back, Paul. But I think the bigger question really within this that I thought we should discuss is tummy tucks, especially on men, and the loose skin of the back.
Yeah. So, yeah, I just feel bad for Paul that it was crappy tummy tuck, but, now he's down another 50 pounds. Let me just look at this real quick.
Yeah, he's now down to, from 225, he's down to 180.
So you could definitely do a revision tummy tuck.
Yep. He's down 50 pounds.
Yeah. We just saw a patient that apparently I'm doing a revision tummy tuck on. They're kind of hard to do. It's not going to maybe make things perfect, but you can definitely do a revision tummy tuck if you have enough skin to remove, residual skin. You may after a 50-pound weight loss.
Yep.
And if the other tummy tuck wasn't aggressive. For the back, especially with this amount of weight loss, you're probably looking at the very least a body lift. So it should be a circumferential approach. So revision tummy tuck that goes around, what do they call it? Like a belt lipectomy. It goes all the way around on top of your butt. And that would take care of at least the lower back. On the upper back, for women, we'll do bra line plasties. And
we've done them on men.
And we've done them on men too. So maybe that's the option we would do for you, or the plastic surgeon would do for you out in California. And those work really, really well. So between those three, the bra line plasty, the extended tummy tuck, which is like a belt lipectomy, which could be extended into a body lift, which would help your lower body. And I think we have podcasts or episodes on all those.
We do.
You can go back and look at that. I think that's going to probably solve your problem, at least get you to a really good place. That's not addressing your arms. I'm sure you have arm problems. Not addressing the inner thighs.
He doesn't bring any of those up.
Okay.
He just says back and abdomen.
Well, there you go.
I think the one really great thing that I read in this was that you have loose skin. So regardless of what happened with your tummy tuck, a while ago, you've lost 50 more pounds. The things we can't fix are when people come in and have a really undesirable outcome from a tummy tuck and they're tight.
Yeah.
What do you do?
No.
You can't put the skin back.
Nope.
So someone who has
it's the same with a facelift too.
Yeah, if you're pulled too tight, like you just have to wait until you have enough laxity to fix some of these things. Even like people are like, well, can't you just at least fix my belly button? Like a lot of times the answer is no.
Right.
Like it's just too tight. So the good thing is, Paul, is that you do have laxity again. That means that it can be better. And the patient that we're doing this tummy tuck revision on, it's the same thing. Like her tummy tuck was about 10 years ago, or even a little bit more, 15 years ago. So that's good. It gives us something to do. Like there's room to adjust things.
She has loose skin now, so I have flexibility.
Yeah.
It's still hard, but I can do it.
Yeah, the belly button can be fixed. The scarring can be better. And the other thing too, you don't mention the scarring, but I'm assuming perhaps part of the crappiness of the tummy tuck is maybe your scar is too high. This could be lowered at this point now. So there's a lot of good here. So I think that you actually,
have a potential.
Yeah, absolutely. And as Dr. Martin said, there's other options for addressing the fat on the back, the other skin laxity, and men do get these surgeries.
But at 51, 6'1", and 186 pounds, come on, man. You're killing it.
Yeah.
You're killing it.
And I'm sure Paul has got you super ripped, like super jacked.
Yeah.
So, I only see good things here. And I think we've not done a good enough job on our podcast in the past about talking about the fact that these surgeries that we talk about can be done on men and women. We don't tend to say that. A lot of times when we show pictures or drawings or before and after pictures, it's all of women for tummy tucks, but a lot of men get tummy tucks.
And we have a lot of male patients, probably more than the average practice. So we're huge into getting the men in here and empowering them and having them have the transformation, especially with weight loss. There's no way around it besides surgery. The surgery itself will be transformative on you, would make a huge difference, would help all the extra skin on your upper back, on your lower back. It probably would elevate your butt. I'm sure you have problems with that. I'm going to make an assumption.
Maybe. Men that tend not to carry as much weight in their lower extremities, though.
All right. I'll put money on it.
Yeah. And just the benefit of being a man.
Paul can write us back and tell us.
Yeah.
But then, I think that, for you, you just have to decide how you're going to organize this, what you're going to do, and how much money you want to invest and how much time you want to spend in recovery. Because a body lift with a bra line plasty would be a fairly long recovery.
But it's long no matter what. I mean, you've been through the tummy tuck. You don't add that much time by adding on the body lift component. It's more uncomfortable to recover from.
Right.
But it doesn't really add a lot more time. I mean, in 6 weeks, regardless, you're going to be back to pretty much everything at that point.
And your belly's going to be super flat.
Yeah.
And you're still going to be 186 pounds at
right.
6'1".
And you have less fat hanging over your shorts. Yeah. You will, though. And I'm sure Paul Revelli will work with you on this. I love the two Pauls. Take a lot of time off from lifting for sure. I mean, you will not be able to go back to lifting.
Yeah, I was working with Paul when I had my hernia surgery.
Yeah, that's right.
And he was like you got to take time off. So he was being the doctor in the equation. So
yeah, well, doctors need that.
Yeah.
Yes. Yeah. Your key for finding a good physician in any location is making sure your doctor is board certified. Look at a lot of before and after pictures, especially I think for men. Not all practices do surgery on men and they do heal differently. We talked about this in our podcast episode recently about facelifts for men. There are things just genetically and just by virtue of being a man, things are a little bit different. So finding someone who is comfortable doing surgery on men, which may seem really odd to say, but that's not everybody, go to someone who does these surgeries on men for sure.
Yep.
So, yeah.
Amy will somehow reach out to you and give you some names.
I'll email you back, Paul.
Yeah.
Thank you so much. So if anybody does want to send me an email directly, my email address is always in the show notes, but it's Amy, AMY, @jasonmartinmd.com. And I do answer those. So please reach out to me. So thank you, Paul. Awesome question. Congratulations. We love Paul Revelli.
Yeah. And we love
amazing.
like 330 pounds to 180.
Yeah, that is a remarkable, especially at 50 years old. I mean, that's just insane. And
Awesome.
like I said, I'm sure you look like super jacked too. So
There you go, buddy.
And you're tan because you're in LA. All right. All right.
And you're what?
Tan.
How do you know he's tan?
Because he's in LA.
Oh, okay.
Everybody's tan there. Like, it's like the first line of Jay-Z, Forever Young, living life like a video.
Yeah.
Where the sun is always out and it never gets cold. I mean, that's like LA.
Is that like LA?
Champagne's always cold and the
Does he
music's
talk
always
about
good.
the traffic at all?
No.
The cost of living, the
pretty
homeless
girls
problem?
hop up on the hood of that car.
Oh, okay.
Yep. Yeah. No, there is no traffic about like homelessness. And,
Please.
Yeah. All right. Moving on.
I mean, I like LA, but man, that place is, I don't know. Okay.
Not all that glitters is gold.
No.
Yeah.
Shout out to Paul.
Yeah. All right. So our next one is voicemail. This is an anonymous voicemail talking specifically about upper back and bra line.
Nice. Love it.
Yeah. So here we go.
Hi there. My question is whether a upper bra line back lift will remove axillary lateral side boob bulge, and during that upper bra line back lift, if that part will be removed as well, or is it just the side of the back rolls? Thank you. I look forward to hearing the answer.
All right. Thank you, Anonymous. Before you answer, I have to say something. All right. So very often patients tell me, Dr. Martin said he could do this. And I say, yes, he can. But that's not what we had planned. So Dr. Martin can do anything.
I can do anything.
Can any surgery be a certain way? Yes.
Yes.
Now, is that the standard way a surgery is done?
Basically,
Perhaps
what
not.
she's saying is everyone gets in my way and tries to make me put words to what I want to do.
Well, but this is really goes to the crux of the question.
I know.
Does a surgery do this?
Yeah.
It can.
It can.
Does it always include that? No. That's where you need to talk to your surgeon.
Right. So
now you go.
The bra line plasty is the upper back. I'm closing my eyes because I'm thinking about it. Okay. And that takes it across horizontally. So that's the stuff that literally sticks out over your bra. So a lot of women struggle with this. And in severe cases, you don't have any other choice but to do an excision of skin and soft tissue with liposuction and literally have a horizontal line where your bra lands. So it's like across the entire back, maybe sometimes it's across the midline of the back. And that can wrap around to the front. And a lot of times I'll wrap that around to the front and then it goes into the outer area or the lateral area. She used the word lateral, which I find very
lateral and
interesting.
axillary.
This may be like David. This may be another medical person. Maybe that's why they're anonymous.
Shout out
Maybe this
to-
is David's wife. Yeah. So that can carry into the outer portion of the breast reduction
Or
scar.
the breast tail.
Yeah. And you think about that, that's affecting the skin and soft tissue laxity in a horizontal fashion. So it's grabbing vertically and pulling together. Okay? So the problem with the anterior or front and posterior or back axilla excess stuff is that can't always be removed in a vertical, like up down fashion. Sometimes that has to go the other way. And you have to take out skin there too. So it just depends on your presentation. You can do liposuction there, and we oftentimes will do body tight on the posterior or back of the armpit and anterior front of the armpit, even in the armpit itself. The body tight energy will cause skin contraction and remove the fat with liposuction. But even in severe cases, sometimes you have to do a skin excision, and that would be done vertically, kind of emanating from your armpit and going up kind of in that crease with your arm straight down that's near your breast. And the same is true for behind. We do that sometimes with mini brachioplasty. So it just depends. And it sounds like she's kind of like a bra line plasty, mini brachioplasty patient.
Or breast lift.
Yeah.
And that's really it. Like a bra line plasty itself is one kind of straight line, but all of these other surgeries, brachioplasty or an arm lift, mastopexy or a breast lift, a lot of times we'll extend a breast lift scar around the back to basically a bra line plasty. Now, is that a mastopexy? It's a mastopexy and a bra line plasty. Right. Same thing that a brachioplasty or an arm lift with a bra line plasty is a bra line plasty with a brachioplasty.
Or you could do extended brachioplasty that goes through the armpit, which would take care of everything we're talking about down into the chest wall on the side or the side of the chest.
Yep. Yeah, so there are a lot of combinations, and that's where, I say bioindividuality, which doesn't really apply to surgery, but it does to nutritional therapy, but just individuality of a person. There isn't one surgery always, and if you're going to a doctor who's like, no, this is exactly it, and it doesn't matter who is there, you're literally trying to fit a square hole into a round hole, or a square peg into a round hole. I know the holes. I know the things. That's not going to
totally embarrassing.
It's not going to work. This is me. Have we
We
met?
literally do surgery, which involves like technical ability, and you couldn't even do the analogy of the square peg and the circle hole thing.
In the round hole?
Yeah.
It's the dyslexia.
Oh gosh.
So that's my point with all of that is that can it be done? Yep. And he can do it. Just like he can do all the other things that people say to me, well, Dr. Martin said he'd do this.
Well,
I'm like,
I would.
Yeah, but that's not a brachioplasty
Again, people get in my way.
Yeah.
And they want me to define terms.
All right, now it's a brachioplasty and a bra line plasty.
I think in most cases, if the bra line plasty is extended to the midline of your torso, emanating from your armpit and going down, the midline of your armpit, it's going to take care of most of that stuff. But sometimes you have to do a vertical incision, not horizontal.
Yeah.
And that's in front of your armpit or behind it, wherever that excess skin is, that's a possibility. Obviously, this is all dependent on your exam.
Right. And just like we talked on our episode recently about breast reduction, there are 4 different approaches of breast reduction. There might be 4 different approaches to a bra line lift that might include other surgeries as well.
But if you want an improvement in the armpit, that bra line plasty has to go wrap around your chest, going almost to the outside area of your breast.
Or up into the armpit itself.
Or up into the armpit, yeah.
Especially if you've already had a breast lift.
Right.
Like at some point, as we've talked about in a lot of our other surgeries, like you have to end the incision somewhere.
Yep.
Especially when you're chasing excess skin, like it has to end somewhere.
Exactly.
So you're not, it would be uncommon, I've not yet heard of someone doing like we talked about upper body lift, but I mean like doing like a mid body lift. Let's call that a mid body lift where you literally did an incision all the way around where a bra would go.
Yep.
The reverse tummy tuck myth.
Well, we do. We just don't do reverse tummy tucks because we don't really like them.
Well, and they scar terribly, and like most people would not want to scar circumferentially around their.
But I've done a
upper
bra
middle
line
section.
plasty, breast reduction.
Oh yeah, and a brachioplasty bra line plasty.
Yeah. So I mean, I've done it all.
Those things together. So yes, the answer anonymous is yes, maybe, and maybe not.
Just say hi to Dave for us.
Yeah. The conspiracy continues. All right, we're going to take a quick word from our sponsor. Quick break. We'll be back with more questions after this break. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
Yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. And we're back. Story time. Get to read some questions.
You're a better reader than I am. I don't have the patience for it. That's the problem.
For reading?
Yeah. Because I'm not joking. When I read any, I know. I was like, these words are way too many. I just need the 3 words that I need to get through this.
But you know what though? I feel like that's one of your superpowers is your ability to like process a large volume of words.
Well, that's
really
great,
rapidly.
Amy. So where am I going to utilize that? Because
medical school.
Okay.
Dave.
Because in real life, people are like, I am not following anything you're saying.
Well, how do you think you get through reading many research papers?
I know, but like half the time I have to like turn my brain off just to function in normal, like general population.
Yep.
And it's not a good life.
I
just want to be normal.
The curse of the gifted.
It works in the OR because I'm so fast and things are going on. People are like, I don't know, just hold on, man. Just follow whatever this dude's doing.
Just keep cutting. Just keep
cutting.
It's
like a tsunami. You see it when I come in the room, people start climbing up like the palm trees. They won't drown.
You do suture really fast, like so fast that like when someone isn't used to being your assistant and they're like kind of like getting lazy on cutting suture, and I'm like, I don't know if there's anything that makes me feel more insane than when I'm watching a surgery that I'm not scrubbed into and you need a suture cut and the person is like looking off the other direction.
Oh yeah.
And like I want to like scream at that person, like, do you not see that he has stopped moving for like a second?
In the old days, you could scream at people.
Cut that suture.
Right? But nowadays, when we treat people better,
in the old days, you could scream at people.
Now I have to be nice and be like, oh, hey, excuse me, sorry to bother you. Do you mind cutting my suture?
Would you mind cutting this suture?
Thank you so much. The way you cut the suture was great.
Yeah. Oh, I remember more than a couple times where you would whack my scissor with your...
Well, you're different. You're family. Yeah. You always treat the people you love terribly.
Faster next time. Faster.
If I had my family members in the OR, I would just yell the whole time. Besides my wife.
Like
I wouldn't
a road
yell at
trip.
my wife. Yeah.
All right. Well, that's Tales from the OR. Let's get back into our questions. Yes.
Let's go.
Okay. So this question, if you listened to our first episode of questions from listeners, we had a question from blah, 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 which I struggled with immensely. And we found character from...
Oh, this is blah, blah, blah again?
Blah, blah, blah again.
Oh, I love blah, blah, blah.
And this question, blah, 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 your questions, like seriously, like hit me right in all the feels.
There's something fishy with blah, blah, blah.
So, well, she's from Sweden.
Yeah.
So there's that. So
I think it's a he. Yeah.
She's just smarter. Yeah.
This Northern Europeans, they're always smarter. It sucks.
So I'm going to read this question, Dr.
I went
Martin.
to Norway and I was like, I'm a real smart dude. And they're like, no, you're not.
And then I'm going to have you guys guess. This is like our 100th episode. So I'm going to read this question and then I'm going to have both of you guess which episode this question came from.
Okay.
This episode was from. So blah, blah, blah asks, thanks for talking neutrophils. Yes, I got you, boo.
Yeah.
I noticed a high NLR, which is the neutrophil to lymphocyte ratio, after surgery. Would you say elevated neutrophil count and low lymphocytes is a normal consequence of surgery? So first, what episode did this come from? When did we talk about neutrophils?
I mean, didn't we talk about it in healing scars?
Ding, 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 Dr. Martin. This was on scars.
I'm not saying anything else.
I was going to say recovery after surgery.
Yeah.
But
yep. It was the episode about scarring.
Well, only reason I knew that is because neutrophils are very important for scar formation.
Correct.
Yeah.
So, Dr. Barton, you go first.
No, you go first.
Okay.
Yep.
So this is a great question. Blah, blah, blah. I love this question. So neutrophil to lymphocyte ratio. Is it normal to see that elevated after surgery? It absolutely is. And there's a reason for that. And that reason is very important. So specifically looking at the neutrophils, if someone has low neutrophil count after surgery, their risk factor of death, infection, sepsis, like everything goes really high. So neutrophils and lymphocytes are both parts of the immune system. So white blood cells and, like Dr. Barton said, the part like lymphocytes are going to help actually with healing, wound healing, but both are going to be elevated, or both the neutrophil is going to be high and the lymphocytes will be low in times of inflammation. So looking at the NLR is actually something they look at in people who they're looking at inflammatory factors. It's a really easy way to look and see, is this person
I'll be very
inflamed?
honest with you. This is not something I check or look at. So the fact that you know that was the case after your surgery, it's very interesting. And that must have been on some lab readout or printout.
Yeah, it makes me think maybe it was a surgery that maybe had other things going on that they pulled that.
Why would someone... Oh, that's true. Okay. Because elective surgery, you're not going to get a postoperative CBC.
No. And you also, I mean, you would expect this, right? Like actually neutrophil, statistically neutrophils are going to be at their highest about 3 hours from when surgery started. And then we'll gradually go back to normal 3 to 7 days after surgery.
Right.
So that's absolutely what you want to see.
Right. And the neutrophils are part of that process of bringing in all the cells to help. And it's ultimately fibroblast. To help make collagen and heal all the traumatic injuries. Remember, we talked about surgery is this controlled trauma. That's all it is.
Yeah,
the body doesn't know any difference. The body doesn't know if you've been cut by a samurai sword or you've had a tummy tuck. You know, it's all the same to it.
If you've been cut by a samurai sword across the midline.
Was that a bad example? So, I mean, just one is done a little more expertly than the other. I don't know, man. If you're a ninja, maybe you could cut it perfectly right along the tummy tuck line. Yeah, so neutrophils are extremely important. That's why if you had someone with a neutrophil deficiency, it would be a disaster after surgery. They wouldn't be able to heal.
Super high.
Everything would go up. And those neutrophils are extremely, extremely important. They're important all the way around. After the clotting process that occurs, like the neutrophils are very, very important in those first couple days for healing and forming a scar and just healing anything.
Yeah, so, mitigating inflammation.
Yeah. So that I would assume that would be elevated. Actual numbers, I have no idea. That's getting in the weeds, and that would probably be something like, as Amy said, more related to medical related surgeries, where the people already have problems to begin with, and they're checking CBCs afterwards. Secondly, you may check a CBC after surgery for what reason, Amy? Even in elective surgery.
Blood counts.
Yeah, hemoglobin, hematocrit, right? Because you could have a lot of blood loss during your surgery. If you do big body cases, your hemoglobin can drop down, or a
lot of liposuction,
a couple grams. So you could go from 14 to 11 to 8, and I've seen that. I've seen people less than 10 after surgery. They can have bleeding after. You can have bleeding after surgery where hemoglobin and hematocrit drop down. So. Really good question.
Yeah, I love this question. So yes, it is normal that was elevated, and I'm sure within a week of surgery they were back to normal.
Yep.
Yes, which is awesome. I seriously all the feels reading this question.
Oh my God.
Loved it. And that you listened to our episode about scars was super cool too. Great episode, by the way. Really good. All right. Next one is from Jacqueline.
Oh, I like this.
Is an endoscopic brow lift good?
Yeah.
How does one find a good surgeon who specializes in that?
That's a good idea. Yeah, I think endoscopic brow lift's really good. There was a guy, I've talked about this before. I think his last name was Vasquez. That's what it was. He was at Alabama Birmingham. He's the one who invented this kind of endoscopic brow lift. I don't want to burst your bubble, but that was in 1993 or something like that. So it's been around for a while. People kind of market it as this brand new, amazing way to do a brow lift, and it's not really that special. It was around when I was training. It does work. I like it. The benefit is you do small incisions with back, not on your hairline, and a little bit back from your frontal hairline, from your forehead hairline, back about an
into
inch.
The scalp.
You do like a little small 1.5 2 centimeter incision, and that's where you stick it in, and you usually do that on both sides. The benefit of an endoscopic brow lift is the small incisions, and also you can remove the corrugators and procerus muscles. Amy, where are those?
So they're muscles of the facial expression.
Right.
So they're going to be
those ones you get Botox-y.
Yep.
in between your eyebrows. Those are the 11s.
These guys, and then kind of they feather out.
Those are the ones that Allergan made a lot of money off of with Botox. So the endoscopic brow lift allows you to remove that muscle. And normally with these, or historically, we've used endotines. You can go back and look at our brow lift. I was just going
to ask about the endotines.
Our brow lift episode where we talk about the endotines, which are kind of like horns underneath your skin and soft tissue.
Like an anchor.
Yeah, it does go away. The problem I've seen with endoscopic brow lifts, this is my opinion, but what I feel strongly about this, is they tend to not last indefinitely, but some of the techniques are newer now. The other problem with endoscopic brow lifts is alopecia. The area where they make that incision can have a bald spot, and that's a real problem because especially with women, the way you pull your hair back or even to the side or the way it's parted, you may see that area of loss of hair. And if you go to someone and does an endoscopic brow lift and they tell you that they don't get alopecia, then they're straight up lying to you because it's inevitable at some point when you do scars in the hair. I do remember meeting someone who we made an incision in his hair.
Someone who may have had an interesting growth on the side of his head.
Yeah. That's the first time we met our producer, Nils. He was actually a patient first.
Well, that's the first time we met.
Yeah. And you can go to episode 1. Yeah.
Yeah. Episode 100.
We talk about that a lot. And that's where Nils is all mic'd up.
That's where Nils met Jason. But Nils and Amy had met for a while before that.
And then what I usually do is just an incision on the hairline. A lot of people, right there. It actually works really well.
It's so good.
And, we actually had a patient, female, who did a hairline incision and then shaved her head for hair reasons, just because she wanted to. And you really could not see that scar. So I don't want you to be afraid of a hairline incision. I do think that works a little better because you're only doing a subcutaneous flap. That flap is then sewn to other soft tissue or other skin, and that wherever you set the brow will stay, and it tends to not drop.
Yeah, your vector of pull is better.
It's easier.
Yeah.
You're not pulling up muscle and all this other stuff.
Yep.
So the
quick recovery.
Endoscopic brow lift is the dissection is underneath the muscle in the area called the galea or subgaleal. And then the hairline subcutaneous brow lift is just underneath the skin. You'll probably bruise more with the hairline incision just because you're just elevating a skin flap.
But have far less discomfort.
Yeah, but it'll be less painful, and I think it lasts longer, and you don't end up with horns afterwards in the area where they put those endotines.
And alopecia.
Now, so let's talk about brass tacks. So say you want an endoscopic brow lift, which I support you on. So who specializes in that? Well, even though it was created by a plastic surgeon, all this stuff was, the ENT surgeons, ear, nose, throat doctors have taken that over and they make it their own, just like deep plane facelifts. So they're, again, the East Coast, West Coast, again, everyone's always fighting for turf. So they're like, oh, endoscopic brow lifts. You'll see that ENTs tend to do this is my experience, tend to do the endoscopic brow lifts and then go from there. But plastic surgeons do it too. I think if you want the endoscopic brow lift, you just have to find someone who obviously, number one, advertises it and go in and see if they have experience doing it.
I would say that you've got to make sure they're board certified before you go see them.
And ENT surgeons do a really good job with endoscopic brow lifts, if that's who it is, if it's not a plastic surgeon.
Yeah, so my recommendation would be to wherever you are located, I think in Arizona, from the AZ here, that you would first search out a board certified plastic surgeon or a board certified ENT surgeon. If
you are in Arizona, email Amy at JasonMartinMD, and I'll give you some. We should just do an episode like that.
Shout outs to other doctors.
Yeah, shout outs to other doctors, because I know people in almost every city.
Yeah.
So I have some names.
You got to find somebody good for Paul, and now you got to find somebody for Jacqueline.
Oh, I got it. I got Paul and I got Jacqueline. Mm-hmm. Easy.
Yeah, we are not a Rolodex. Yeah. But really
it's like
key.
Angie's list, but it's Martin's list.
Right, Martin's list. Either way, very key. I mean, getting referrals from friends or people who've had these surgeries before is great, but always make sure that your doctor is board certified. Always. Mm-hmm. My number one. Always.
But I think I answered that, but how does one find a good surgeon who specializes in that surgery? Now, we have a great episode on how to select your doctor. Or was that a question that a patient called in with and said, how do you know if someone's good or not?
They may have, but we do have an episode about selecting a surgeon. We also have an episode about why board certification matters. And that matters regardless of what field you're looking for someone in or what type of surgery you're looking for. Those things matter.
Yeah.
Yep. So they're, really specialize in. I mean, this is the other thing we talk about in our episode about board certification. You can literally say anything in advertising and it doesn't make it true. Like there are doctors who say that they are plastic surgeons who are not. They say they're cosmetic surgeons. There is a cosmetic surgery board that is not the American Board of Plastic Surgeons. So there are a lot of terms that people use to make themselves look like they specialize in something, which does not make them an expert or make them qualified to perform it.
Yeah, and we've had people request to be on our show that aren't board certified or come from some of those organizations, and we've turned them down. Not that they wouldn't be good guests, and I'm not trying to throw,
Yeah, we just hold ourselves to a different standard.
Yeah, but if you're going to come on our show, which is probably going to be never, but if you did, you would have to be board certified, everything we espouse to our patients. And we think that's really important. Secondly, once you find out they're board certified, then you can actually just query in Google in your Centroid in Arizona, probably Phoenix or something. Then you can just query endoscopic brow lifts and kind of start working through those websites and see if you can see before and afters. But endoscopic brow lifts are not extremely complicated. I think if someone does them on a regular basis, I think in their board certified, I think you can be fairly confident that they're going to do a good job.
Yeah, and meeting with multiple surgeons as well. That's important. Good doctor or good surgeon for you may not be a perfect surgeon for me or for Dr. Martin, just because of our personal preferences and what we're kind of looking for in a provider. Doesn't mean that all their surgical skills are not equal. It's really important to find somebody that you kind of jive with.
I mean, I have a Dr.
Jive.
Strange vibe, so maybe a patient doesn't like Dr. Strange.
There you go, right? Maybe, yeah, there's a lot of reasons why.
I'm going to find that guy on the internet.
Dr. Strange?
No, that commenter.
The commenter? We will not come after our commenters.
I'm joking with you.
Because one time somebody commented that they thought I was annoying. And
I can't even imagine.
You're not wrong.
Amy doesn't show me the comments. Yeah. I'm sure there's a lot of negative ones on me, and I totally get it.
Somebody thinks I'm annoying on the podcast. Meet me in real life.
I knew I do really good surgery. We got that going for us. Yeah.
This is me. We're the same in real life as we are here.
100% the same. We had a patient fly in for surgery with us and said, "I can't believe you are the same people that you are on that podcast." I'm like, exactly. It's 100% us.
Yeah, Nils can testify to this.
We don't change.
No, this is really what you get is what you
All
get.
the dumb jokes.
My dyslexia is real.
Commenting on 1990s hip hop and music.
Yep.
Pop culture quizzes.
Yeah. So Jacqueline, if you aren't into that, then we're not the doctor.
Yeah. Exactly. No, but email Amy and I can give you some names in the Phoenix area. I have some really good friends down there who do a great job.
Awesome. All right. Thank you, Jacqueline. So blah, blah, blah makes a comeback.
Oh, I like blah, blah, blah.
There were just so many good ones.
Yeah.
So this is proof to people that I do read all the comments. So this amazing patient or person, not patient, left many messages on many episodes. And this was a really good one too. And this is also about brow lifts. And that's why I put these two together. So what's your take on brow lift combined with upper bleph or upper eyelid surgery? Some surgeons seem to be of the opinion that you must do the brow to know how much to take off from the upper eyelid. As someone who wants to do as little as possible, I'm skeptical about this view, but I'm also easy to change my mind if I understand the rationale behind it. Thanks for a very educational podcast. I'm getting back to my medical studies again. This was a joke. She's joking.
Is she messing with us?
That's a joke.
Is he messing with us?
This is not Dave.
Oh man, there's a movement out there. All the medical students, even in foreign countries, are coming after me. I'm ready for you. Blah blah blah.
So great question. Yeah. So I've never heard of someone ask that, you have to do a brow lift first to know how much to take off of the eyes, but I could see why somebody might say that.
So everything that people do in plastic surgery, both patients and doctors, they always overcomplicate it. That's what everyone does in life, right? So this is everyone take a step back, including blah, 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 blah. In reality, you can do the eyelids first or you can do the brow first, but you have to adjust accordingly, right? You have to adjust accordingly. And the hard part is, meaning that once you do the brow lift, if you do the eyes, you have to make sure you don't take too much skin off. Or if you do the eyes first and you do the brow lift second, and I'm talking about the same surgery, then you would have to do, make sure you don't lift the brows too much where you cause problems. Where that becomes very hard is the markings. So the markings before surgery, we mark people in the preoperative holding area. For the upper eyelids, we mark a fusiform pattern. What is that in English language? Fusiform,
It's almost like a kind of like a football.
A football shape. Mm-hmm. Yeah, that's great. That's good. There's no football in Sweden. That's soccer.
Rugby.
Okay.
Rugby is just a bigger football-y shape.
Right.
It's like
a snap pea.
Snap pea.
A snap pea. I have no idea how to relate this to a Swedish person. So anyways, we mark that. And then also for the brow lifts, we mark up in the hairline. So the hard part would be is if you do the eyelids and you take off too much or you're aggressive and then you want to do the brow lift too because they also have brow ptosis or droopiness that you could get into a problem. So that's where, to be honest with you, it's a good question, but you have to go to someone with experience. What I usually do is actually start with the eyelids because that's the most like definitive in terms of how much skin you're taking off. And I can adjust the brows accordingly. So I can back off the brows if I need to. The second thing where it gets weird is you inject the local fluid in there, it can cause swelling and then it gets distorted and it's hard to know what you're doing. So the advice that I give to the fellows when they rotate through is when you do the eyelids first is to be very conservative with the eyelids. And then you can make up the difference with the brows if you need to, within reason. You don't want to overlift the brows and then cause some distortion. But that's not complicated. My 15-year-old son can figure that out, right? Okay, well, I'm going to pick the one that's least adjustable to do first, which is the upper eyelids, and then go from there. I could sit in a room with 100 plastic surgeons and half of them would argue with me about what I just said. So that's fine. Do the brows first, and then the eyelids, adjust those accordingly. You know, don't inject the local until you readjust your markings. That's the easy thing to do there too. So either one.
I think what she's saying there, the surgeon is saying she has to have a brow lift if she's going to have an upper eyelid surgery.
That's not true.
Yeah.
You can have low brows and you could do, we do tons of men and they have receding hairlines. You can't do a brow lift. And they have like Herman Munster. You don't know who that is. Eyebrows.
She knows who we are. She might know who Herman Munster is.
Okay.
From the Addams family.
Addams family, where the brows are like this. I mean, you can't lift them or you'd have to put an incision right in their forehead.
Do right-side incision.
Yeah. So in those, we just do the skin removal on the eyelids and it turns out great and they look better.
Well, and like I would say greater than 90% of the upper eyelid surgeries we do not do in combination with a brow lift.
Right. But if you have droopy brows and heavy eyelids, those are two different problems. They're contributing to each other. In most cases, a brow lift's not going to solve heavy eyelids in most cases alone. And you'll have to add a blepharoplasty onto that.
But a lot of times people are surprised that we recommend a brow lift over an upper eyelid surgery because a brow lift will fix the problem.
Right.
You know, people perceive that their eyelid is too heavy, which in some cases it might be getting close to that, but really a brow lift is what they need to kind of open their eye back up.
And this doesn't even get into ptosis of the eyelid, droopiness of the eyelid, levator dysfunction for people as they get older.
The word I can't say, blepharoplasty.
Oh my God. Blepharochalasis.
No. Nope.
Okay.
Nope.
All right.
And Herman Munster was on the Munsters, not the Evers.
Oh,
hence the name the Munsters.
Yeah, the Munsters. Did he like do a crossover? Like
who was the Herman Munster guy in the Addams family?
Grandpa?
No, Uncle Fester. It was Uncle Fester.
Yeah,
but he had the.
You're talking about the big guy.
Yeah.
Didn't they have like a big butler?
That was at Fester. Well, they had the huge.
It's so funny.
Lurch.
Those shows.
They had Lurch. Lurch
Yeah.
didn't speak.
Yeah, Lurch.
Yeah.
Right.
Yes.
Those like shows like are totally together.
In my mind, they are the same show. Honestly, I don't know the difference between the Munsters and the Addams family. It's the same show. Wednesday, Tuesday. Yeah. Yeah. So again, blah, blah, blah. Excellent question. The thing is, there's, you can always do more. And I say this all the time with plastic surgery. You can always do more. So doing one or the other first.
If someone tells you you absolutely need a brow lift and a blepharoplasty, just go somewhere else.
Well, or say like, well, I only want to do one.
Yeah.
And
I'll do the brow lift later.
And ask them what they think is the most important thing for you. And then decide if you think that that's the right answer for you. Yeah. Like I need my upper eyelids done and I'd love a brow lift. But more importantly, I need my upper eyelids done. So like if I had to choose right now, I'd be like, do my upper eyelids because they're worse.
Your upper eyelids are fine.
They're
crazy.
bad.
No, you're crazy.
Getting a facelift next week. All right.
I'm the one that's screwed. I mean, who's going to do my facelift or my brow lift?
I'm going to do it.
Nils is not going to do it.
I'm going to do it. I do your brow lift. I don't know if I could do I think I could do your facelift.
Oh, God.
I think I totally could.
Help me, Lord.
I could.
All right.
Yeah. All right, everyone. So thank you all so much for sending in your voicemails and your comments. Super awesome. We love doing these type of episodes. I think they're helpful. Like I actually love listening to question and answer types of podcasts because you never know if someone has the same question.
You may have to send a mug to blah, blah, blah. Because that was some.
I don't know if you can.
Can you send it to Sweden?
It costs $150.
Right. Blah, blah, blah. When you come to the United States, hit me up.
Stop in Denver.
Well, you don't even have to stop in ever. Anywhere in the U.S., I will send it to you. Because, yes, sending a cup to Canada for our fabulous Canadian listener did cost about $50 US, and that was 2 years ago. So, yeah. So we will not be sending.
Yeah, but she's like Nova Scotia out. Is it Scotia?
Scotia.
I'm sorry.
This is not a sconch.
Yeah, she is out in the middle of nowhere. So, I mean.
I don't think that matters. It's like the Canadian Mountie delivers the mail, right?
I had to go in a boat and a moose.
And a moose. Yep, some type of upriver paddling.
Yeah.
Yeah. Now that we've offended all of Canada, I feel like we've maybe said things about Canada before. The money.
I love Canada.
Yeah,
I love Canada. It is such a beautiful country.
Yeah. Oh, the Canadian
winters
are gorgeous.
Maybe not, but summers, man. There's nothing better than Canada.
Yeah. Yeah. All right. So if you would like to be part of our next listener questions / watcher questions, you can find us on all social media platforms at Jason Martin MD and at Beauty and the Surgeon Podcast. All of our social media handles are here. Our phone number for voicemails is 303-630-9038. So you can hear yourself on the podcast, which would be super awesome. Dr. Martin, do you have anything else to say?
No.
Oh, I do.
Yeah.
Big podcast news.
Okay.
This is huge. So we are remodeling our podcast studio.
Oh, this is so crazy.
This is the last time you'll see us like this. It's going to be totally different the next time you see us.
If we really cared about promoting this podcast, we'd put this all over Instagram and show the steps of the transformation.
Well, it hasn't started yet, so maybe we will.
We will not.
We might.
The next show will be different.
The next show will be different. So
it's going to be awesome.
Yeah, leave us some comments on our new backdrop when it happens. It'll be totally
Wouldn't that
different.
be funny if we don't do it, which is so us?
And it's just like this again.
The next show,
and
everyone the real listeners are like, well, it's no different.
What'd you change? Oh, it's subtle. Remember, we always talk about subtle differences are key.
Little lighting differences.
You can always
there.
do more. Yeah.
I moved the cup to the right just a little bit. Yeah.
Yeah.
Okay.
So we're gonna be coming at you from this same room, but a redesigned studio. The next time you see us, hear us, worth checking us out on our YouTube channel so you can see the new stage, the new studio. So thank you everyone so much for listening, and we'll see you next time.
See you next time.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.